Journey through the body. Pharmacology story. Imagine the human body as a city controlled by different systems. We start at the heart. Here, beta-1 receptors control heart rate and force. If the heart is overactive, we use beta-1 blockers like Metoprolol and Atenolol to slow it down. But Propranolol is non-selective. It blocks both heart and lungs. Now move to the lungs. Beta-2 receptors open airways. In asthma, we give Albuterol for quick relief and Salmeterol for long-term control. Next, we travel through blood vessels. Alpha-1 receptors cause vasoconstriction, leads to increased blood pressure. Phenylephrine stimulates this. Alpha-2 receptors reduce norepinephrine release, leads to lowering blood pressure. Clonidine does this. Now enter the nervous system. Acetylcholine is an important neurotransmitter. Atropine blocks it, anticholinergic. Neostigmine increases it, ACHE inhibitor. Physostigmine does the same but can cross the brain in poisoning, like organophosphates, we treat with atropine. Now let's calm the brain. Benzodiazepines increase. GABA effect. Barbiturates increase. Duration of GABA. If overdose, use flumazenil. Now pain control. Morphine. Meiosis plus respiratory depression. Fentanyl leads to very potent overdose. Leads to naloxone psychiatry ward brain. Haloperidol leads to causes EPS. Clozapine leads to risk of a granulocytosis, SSR. IS leads to first-line depression. MAO inhibitors leads to dangerous hypertensive crisis. Mood stabilizer. Lithium causes hypothyroidism. Seizures. Valproate liver toxicity. Carbamazepine, trigeminal neuralgia. Phenytoin leads to gingival hyperplasia. Ethosuximide leads to absent seizures. Parkinson's, levodopa increases dopamine. Selegiline prevents dopamine breakdown. Infections. Tuberculosis drugs. Isoniazid leads to B6 deficiency neuropathy. Rifampin leads to orange body fluids. Ethambutol leads to optic neuritis. Pyrazinamide leads to hyperuricemia. Antibiotics. Vancomycin leads to red man syndrome. Gentamicin leads to kidney damage. Tetracycline leads to teeth discoloration. Chloramphenicol leads to gray baby syndrome. Sulfonamides leads to kernicterus. Penicillin leads to allergy. Cephalosporins leads to similar to penicillin. Azithromycin leads to atypical pneumonia. Ciprofloxacin leads to tendon rupture. Metronidazole leads to disulfiram-like reaction. Fungal and viral amphotericin. B leads to nephrotoxicity. Fluconazole leads to antifungal. Acyclovir leads to HSV/HIV drugs. Zidovudine. Efavirenz. Ritonavir. Oseltamivir Aero influenza. Interferon Aero boosts immunity. Cancer therapy target. Methotrexate Aero blocks. Folate. 5-FU Aero blocks. DNA synthesis. Cisplatin Aero. Kidney damage. Doxorubicin Aero. Heart toxicity. Bleomycin Aero. Lung fibrosis. Tamoxifen Aero. Blocks estrogen. Hormones and metabolism gear. Insulin Aero. Drives potassium into cells. Metformin Aero. Risk of lactic acidosis. Sulfonylureas. Aero increase insulin. GLP-1. Agonists lead to weight loss. Lipids, statins lead to muscle pain. Niacin led to flushing. Fibrates led to decreased triglycerides. Ezetimibe led to decreased cholesterol absorption. Blood and clotting. Warfarin led to teratogenic heparin, led to safe in pregnancy. Alteplase led to dissolves clots. Pain and inflammation. Aspirin leads to Rey syndrome in kids. NSAIDs leads to kidney damage. Acetaminophen leads to liver toxicity. Antidote leads to N-acetylcysteine. Other important drugs. Hydroxychloroquine leads to lupus. Colchicine to gout. Memory trick for the whole story. Think of it as a journey. Heart to lungs, to vessels, to brain, to pain, to psych, to seizures, to infection, to cancer, to metabolism, to blood, to pain, to misc.